for those on the West Coast as well. Um, my name is Teo Kimaboy. I'm currently the nominating committee chair-elect on the Student Assembly Board of Directors, and we're happy for you to join us tonight for October's APTA Student Social. As you come in, feel free to have your video on. If not, it's okay to keep it off. And as we go throughout tonight with our discussion, please feel free to type any questions you have in the chat. You can use the raise hand feature if you want to unmute yourself and ask the question anyway. We are okay with both options. And so tonight we have our event here with Dr. Zachary Rethorn, as well as Dr. Guerrero, who we're hoping she will be able to come on soon. But if not, we can always start it off with Dr. Rethorn. Either way, it's okay. So to just begin, if you can please just give us a quick, brief bio about yourself, we really appreciate it.
You bet. Yeah, thanks so much for having me, Teo. I'm really glad to be with you all tonight and share a little bit about prevention, health promotion, and wellness, kind of some of what I've done and also what I think are some of the opportunities for you all as you think about your time as students now and also as you graduate and become colleagues with me in the profession. So I graduated from the University of Tennessee at Chattanooga in 2015 with my DPT and pretty immediately saw that the skill set that I had received in my education was not cutting it with the patients that I was seeing. So I was working in a very low resource environment where patients had a lot of behavioral and social drivers that were impacting outcomes. And I saw that what I was prepared for was not to actually address those things. So I could treat the patient, but I couldn't really ultimately get at the reason why they were getting musculoskeletal conditions in the first place. And that really bothered me. So I went and I did an orthopedic residency and I said, okay, maybe this will be the thing that helps me connect with my patients and get that, level up skill set, and really be able to understand the literature and really to prescribe evidence-based practices for my patients. So I did that and it helped my outcomes a little bit, but still not what I was looking for. And that's really when I started saying, what else is going on here? How else can I use my platform, my position as a PT to serve my patients? And that kind of led me down the road of looking into prevention, health promotion, and wellness and saying, okay, based on the data, we know that musculoskeletal disorders don't happen in a vacuum. They happen in a context. And the prevalence and incidence of musculoskeletal disorders in general are largely affected by health behaviors like sleep, diet, stress management, substance use, physical activity. The building blocks of a healthy lifestyle are really what can modify and shape the prevalence, incidence, and outcomes for musculoskeletal disorders. We have really strong evidence across a host of different conditions that these things all really do matter. And so started working on that. I did a health coaching certificate to try to see what, ultimately I can't be the one to change this. So how can I help folks uncover their own motivation to change or not? And then at least we can be on the same page about expectations. And I can offer that these things may help. And if you're ready to change and you have the resources, great. If you're not, what else can I do? As I went through that, I realized, again, this happens in a context. And so attending to the behavioral drivers or the health promoting factors still isn't enough. That we really need to be looking at social drivers as well, because it happens in a context. We live in contexts. So I started thinking about what can I do to attend to, especially when it comes to physical activity, the environment. Are there ways that I can get involved in our Department of Transportation locally and try to encourage physical activity from that perspective? As I started reaching out, I realized our Department of Transportation knew a lot more about this than I did. Everybody there was on board with it. What they really needed were they needed some specific asks from clinicians like me who had access to real people in neighborhoods that needed better infrastructure. They needed folks to come out to specific meetings when they knew stakeholders would be there. We needed a flood of people to come actually at specific meetings and say, look, this matters. This is important to us. This would really improve the way we're able to access opportunities, the way we're able to access parks and recreation across a number of different factors. So I learned through that a lot of what I didn't know. And that's kind of the journey I'm on today, is still looking for levers to pull. I would say my career has been one where I am searching for levers to pull on, where I can change, at this point, structures and systems to try to improve access, equity, and outcomes for musculoskeletal disorders. So my current role is as a postdoctoral research fellow in the Durham VA. So working with veterans, I'm on a bunch of projects looking at telehealth and trying to improve access to care via telehealth for rural veterans, looking at group physical therapy models of care as well. And then my own research is more focused on attending to behavioral and social drivers in clinical practice. So that's a little bit about me. I see that you all are putting your information in the chat. I appreciate you doing that because I always like to know who I'm speaking with and kind of what your backgrounds are. I'm going to add one other, if you don't mind, Teo, I'm going to add one other thing that I'm going to ask everybody on the call to do, which is just to, in a sentence or in a word, go ahead and just tell me, how are you feeling coming into this? Are you skeptical? Are you thinking like, what the heck does this have to do with anything that I'm being taught in school? This has nothing to do with what I'm interested in. Are you bought in? Are you thinking like, wow, this is where we need to be going? Talk to me a little bit about where you are coming into this tonight as the first thing. And maybe the second thing would be, what do you hope to take away from this conversation? If you were to finish this conversation and go, wow, this was something that really either changed the way I think about things, or that I really want this one thing where I can feel like I can move forward. What's something you want to take away from this tonight? So two things. First, how are you feeling coming in? And second, what do you want to take away? So if you could go ahead and you can be brave and unmute yourself, or you can go ahead and put that in the chat for me as well.
I'm gonna step up and be the first one to say something, but I think something I want to take away is something. What can I do? So I'm a new grad PT, living in Southern Cal. So what can I do on a day-to-day to focus on some of these like health disparities, and what type of information or resources I can lead my patients to?
Yeah, awesome. Thanks for sharing that, Patrick. Hopefully by the end of this, we can definitely cover some practical steps or some ideas or trajectories you could think about moving forward in your own practice. So congratulations. Thanks for kind of being with us. I appreciate, as a colleague, hearing this as well. So congratulations to you for finishing up, and excited to kind of converse more with you as we move forward about your role and kind of how we can think about moving this into day-to-day practice.
Thank you for starting us off, Dr. Rethorn, but we also have our next guest here as well, Dr. Guerrero. If you would like to unmute yourself and just give us a little bit of a brief bio about yourself.
Thank you. Thank you for having me this evening. It's an honor to be with you all. I am a doctor of physical therapy. My background is largely from Harlem in New York and Manhattan, and I started out in outpatient orthopedics and really dove into pediatrics about 6 months after graduating. So I have literally worked in a lot of prevention, health promotion, and wellness from that era of my practice, and then have since worked in hospital spaces and most recently at the American Physical Therapy Association as a practice specialist, where I have the honor of being the liaison to the APTA Council on Health Promotion and Wellness, and really get to do a lot of what I enjoy doing in practice at work, and being one of the proponents for physical therapists in primary care. So we are in the process of petitioning for that to become a reality, and I'm happy to be here with you this evening to discuss today's topic.
Yes, thank you. And again, just for as Dr. Rethorn was mentioning earlier, if you want to type in the chat things that you're looking forward to out of this talk and resources that you're looking to gain, as well as just how you're feeling about the topic, definitely feel free to type that in the chat, as well as continuing on. Where are you viewing this from? What year are you? Are you SBT or SPTA? And again, feel free to unmute yourself if you do have a question, or you can type it in the chat. We are open to both of those because we want to keep it as an open conversation. But we actually had someone type that they're interested in learning how they can promote health and wellness to their patients still pretty early, but they think the earlier they can learn, the better, right? And I definitely agree with that. So going off of that, just briefly so we can all get on the same page, how would you both define prevention, health promotion, and wellness?
Who would you like to go first? Okay.
Go ahead, Hadiya.
I'll begin, even though Dr. Rethorn has the PhD in it. So I look at prevention health promotion as part of the continuum of care. I think in the United States, we are highly modeled after what I refer to as sick care. In other words, we wait till people get sick to care for them. And actually it's almost like a capitalization, meaning capitalism in woven into our healthcare system, whereas we make money off of people being sick, right? So prevention, health promotion, and wellness is that piece that you do daily or moment to moment that helps keep people healthy. Health promotion is that, for me, the general area of doing things or implementing and educating people on that which we define as health. And when I say we define, I mean that societally and culturally. And the reason why I say that is because there's a time, like if you look at ancient Greek or Roman, or you look at even in African nations, where being overweight was actually a sign of wealth, right? We look at that now as something that is a sign of unhealthiness, a sign of sedentary, a sign of chronic conditions. So that's why I say as we define. I don't say that lightly. But as day to day, as far as physical therapists are concerned, there are aspects in which we were educated, and we continue to learn as we practice, that we can ask people questions and help give them guidance in areas that include their sleep, their nutrition, all of these things, asking them questions about where they live or what is their access to certain things that we're recommending that may be impacted by their environment. So health promotion, it really encompasses a ton of things. I think it's easily even confused with population health per se, because health promotion is an aspect of population health. So I'll pause there and let Dr. Rethorn give his definitions.
Yeah, no, I'm going to agree with you there 100%, Hadiya. I think that for me, the way I would probably delineate between the terms is prevention really is thinking about avoiding something or reversing something. And so that's really the paradigm I think of prevention, is honestly probably in avoiding, right? So we know that when it comes to overall health conditions, that the health behaviors Dr. Guerrero mentioned, physical activity, diet, sleep, stress management, we know those things matter. And we know that if folks are able to take different, to take steps toward kind of what we in the medical community think of as a healthier behaviors in those, and again, attending to the fact that certain things are definitely culturally conditioned, I think that there are opportunities to ultimately advance health in that direction. So prevention is preventing or avoiding things. Health promotion, I really think of the main idea there is empowerment. And that's really the way I think about health promotion. It's empowering an individual who's across from you. It's empowering a community even to increase control over their health. That's what I think of as really the core tenet of health promotion, is this empowerment so that the person across from you has a perceived sense of greater control over their health. And then when you think about wellness, that's when I start thinking about things beyond sort of biomedicine or physiology. The Ottawa Charter definitely talks about health is more than an absence of disease, though, right? It's not just about the absence of disease. It's also a positive sense of flourishing. I think wellness gets at that idea probably more than what we think of when we think of health typically. We think of very physical or biomedical conditions when we think of health. So I like the term wellness because you can think about a physical dimension, but you can also think about an emotional dimension, an intellectual dimension, a social dimension, a psychological dimension, even a spiritual dimension when it comes to wellness. Those are all in the definitions of health, but that's not how we typically think of it. So I appreciate that wellness is a term for me that probably should be lumped in with health if we're honestly thinking about it, but it needs extra emphasis because we typically don't think of it that way, is my perspective. So Dr. Guerrero, I'd love your thoughts on that. I'm sure I've left something out as well that you could speak more to.
Actually, I was thinking that I love that. I couldn't agree more that wellness encompasses all those, not paradigms, but all those aspects of well-being and that physiological look and biological look at health, and really goes beyond just your cellular level of well-being, but the whole person. And I think that prevention, health promotion, and wellness really get at that, right? It really pushes us to move beyond the solely medical model or the historically medical model of just making sure people who are sick get better, but actually looks at a person as a whole being that experiences things that are happening within them, but also the environment and those around them, and even socially, right? Because what if we've learned anything, one of the big things I think lay people are learning from the pandemic that most recently we're in, meaning COVID-19, is that we're social beings. And I think people know that we are social beings on an inherent level that they might not think of, but they don't really appreciate until we're in a circumstance like this, where everybody's impacted by it, where you actually learn what we already know, which is the more that you're isolated and you don't have those social interactions, loneliness is actually linked to your mortality, right? You're more likely to die sooner. And not interacting with even a baby, right? A baby that doesn't get touched or hold or held and interacted with actually doesn't develop normally neurologically, right? So it takes sometimes these big things to bring everybody to a certain level on the same page so that we all can not just promote what we think belongs to a select few, or in the definitions or terms of health promotion and wellness and prevention, but actually something that all people should be entitled to. And we're realizing that, there are a lot of differences in the way we perceive what wellness is, but there's also a lot of difference in the access that people have to achieving their ultimate wellness and well-being.
Thank you both for that. We really appreciate it. So now we all have a base on how we want to define prevention, health promotion, and wellness, but kind of going off the comment that Bernardo just put in the chat, stating how health promotion and prevention is what will progress the profession. But he's also looking to see, the next question really being is, all right, as students, SPTs and SPTAs, what can we do, or what are some things that you would say as students that we can do now to help with prevention, health promotion, and wellness?
I keep being slow on that unmute button. So I guess I would reiterate some of what I started to say. So some of the ways that you can start to implement aspects of prevention, health promotion, and wellness into your care include yourself, right? Leading by example, or learning to do things for yourself that create some level of joy for yourself, whether that's being around and communing with people who are not just of like mind, right? But are people who actually challenge you beyond that which you already think. So that when you go into situations like you do when you're on your clinicals, or later on when you're practicing, that you receive your patients and your coworkers and colleagues from a space of openness, but also with the knowledge of all that you've been educated on. So it's important, and I really thank the council for really honing in, and by council, I mean the Health Promotion and Wellness Council of APTA, for honing in on that. We should not just be doing health promotion and wellness in our wellness half of our studio. It's actually something that should be incorporated in any setting or conditions that you work with, right? So I could be in the ICU and working in a pediatric ICU, and I actually want to know how the person slept, right? Because that's actually going to impact how, I'm not just going to ask, I'm actually going to document, right? I'm going to, because if I can see that there are patterns in the way this person responds to the interventions that I'm proposing, I can potentially have an impact on how that person progresses from their place of illness and there beyond. One thing I also would say, and then Dr. Rethorn, I'll pass to you, is I think it's key for us to not just be brave, but see it as an obligation to ask people all of those things that we know contribute to their well-being. So their nutrition, are they someone who smokes? and what they look like as far as what we mentioned earlier, which was access. And you do that not because you as a physical therapist or physical therapy assistant or student can fix all of those things, but as an obligation as to making sure that you connect the person to those things that will actually help improve their overall well-being and actually optimize the care that you're implementing through physical therapy. Dr. Rethorn.
Yes, 100% what Dr. Guerrero just said. I think what she touched on and what I would maybe draw out a little bit more explicitly is one thing you can do as a student now is you can get in contact with folks in the APTA Council. So I didn't mention this in my intro. I'm on the steering committee until the end of the year with the Council on Prevention or Council on Health Promotion and Wellness. We did a name change to make it more streamlined. But honestly, there are folks in there who have been doing this for 30 plus years who have a wealth of information about what to do and what not to do. That this road has been trod already. And even though this topic may feel like it's kind of new or is a way to progress the profession, as Bernardo mentioned, there are folks that have been doing this already for a long time and have lessons learned that can contribute. So specific things I would say is, for me, when I started practicing and I didn't have any of these questions in my workflow, it was figuring out what are the right questions to ask about physical activity, about sleep, about stress, about diet, about substance use. Are there validated questionnaires that are short enough to incorporate in my clinical workflow that are going to be meaningful information that I can document in a specific place and kind of build the logistics in so that it becomes something that's just a part of what you do in practice. I think when I've talked to clinicians and interviewed them for my research, the folks who do it well, that's what they end up doing. It's just kind of seamlessly woven in. They don't need extra time to do this, to be a health promoter in their everyday practice. They don't need extra resources even per se. They have found ways to weave it in. So it's really a logistical question, I think, at that point of how do you find the right questions to ask or the resources that you can just kind of seamlessly put this in. And that takes practice, but that also takes preparation. And so I think as a student, you can start the preparation now, depending on where you are. So you can compare, the different physical activity. There's a single item question you can ask. There's 2-item questionnaires. There's 7-item questionnaires. You can look through some of the literature. You can talk to your professors at your program. I know we had someone on the chat earlier who's at St. Kate's. So you can ask Dr. Ingman, what do you recommend for these different areas? What screeners would you have me incorporate, or what ones would you consider? I think those are some very specific ways that you can start to think about moving forward and integrating this into practice. So like Dr. Guerrero said, it's not just the wellness half of your practice. It's not just, oh, well, if somebody explicitly wants this from me, then I'll go ahead and ask this. I think like Dr. Guerrero mentioned, I would say personally, my perspective is this is all of our professional responsibility, that this is part of what it means to be a PT is we should care not just for the rehab of somebody, we should care about the health of our patients. And if we don't think about these topics, I would argue we're not actually doing a great job thinking about the health of the people we're serving. So I think there's, for me, a very deep sense of responsibility that comes with this, as Dr. Guerrero mentioned. And so I think about how you can begin to start finding resources, get to know folks, and then begin to think about the preparation for logistics. Those would be kind of the 3 things I'd say, even as students now, are great things to be thinking about.
I would just add before we go on, Taya, that, and some of what I wrote, things you can do now are volunteer, right? There's so many things on a community level, whether you're at school, and I know it feels like we don't have time, but I'm a firm believer that we have time for the things that we want to do, we make time for. And so there's things on your community levels, whether it's at a community center where you volunteer your time, or whether it's actually, for example, I volunteer and I do track and field coaching in DC. That's an aspect of health promotion and wellness, right? Because if you know anything about sports, you know that it contributes to a child becoming more likely to stay out of harm. It's more likely for them to be leaders within their organization, and so on and so forth. So things like that we might be overthinking not overthinking like too much, being over analytical, but those daily things that you can do right there within your community are things you can do. You can be a proponent for having healthy food and going to town halls or speaking to your legislators about policies and or stocking of food, and speaking to the people who are in your local grocery stores and making sure that if you're not somewhere that's an affluent area and you notice the difference and you have to leave your community just to get food that you think is edible to put on your plate, then what do? You talk to the people who are physically in your community and see what you can do to get that change so that you don't have to leave or live or see other people live in food deserts.
Thank you both for those responses. Definitely think a lot of us got some new resources that we can add in order to figure out how we can be included in prevention, health promotion, and wellness. So before we move on, we're going to head into a few announcements. So I'm going to pass it over to Patrick, and he will get us going with some of those.
Yeah, I'll try to keep this brief so we can get back to the conversation. But so the first announcement, the annual award to recognize one SPT and SBTA for exceptional overall accomplishments and contributions to APTA, the Outstanding Student Award. So Teo's going to drop the link in there. So go ahead and apply for that. So when the SBT that wins gets a $1,000 scholarship, and the SBTA gets 500. On to elections. Voting for the next APTA Student Assembly Board of Directors is now open. Be sure to go ahead and cast a vote. In addition to selecting your future representatives, 2 study guides from Score Builders and 2 base camp annuals will be raffled to students who cast a vote. So go ahead and do that. And we have Flash Action Strategy. APTA will lead a Flash Action Strategy on October 20th and 21st in support of Allied Health Workforce Diversity Act. So over the course of these 2 days, we'll mobilize our members and patients to send letters to Congress in support of the act. And next, we also have CSM registration is now open. So it's a great time to meet other students, other professionals, and learn together and network. So, and that's all for the announcements.
Thank you, Patrick. All right, so first, before we head back into the conversation again, everyone who is here, if you would like to unmute yourself, please feel free to use the raise hand feature, and you can definitely speak to any question that you'd like to ask, or you can continue in the chat box because that's been great so far. So, all right, we've understood what the definition is. We've gotten into how we can get involved as students, but we go through, we learn these things, we go and take the boards, we graduate, but then it seems as if some of these ideas that we may have learned can sort of go away. So I know I kind of had this framed for a question for you, Dr. Rethorn, but kind of speaking to both of you, if you can answer, why is it that you see afterwards outpatient PTs aren't really as focused on physical activity promotion?
Yeah, that's a great question. And that's an interesting one, right? Because hopefully all of you on the call are getting information, or if you haven't yet, if you're in your first year, hopefully you will get something in your curriculum that will train you to be able to incorporate this into your practice. And so you can meet that professional responsibility that we all have. The reality is, though, that when you talk to folks who are out in practice, it's not a common thing. So at best, globally, it's maybe 50% of physios do any kind of physical activity promotion or kind of think about, I say physical activity promotion, that's kind of I think a proxy for all of these topics in health promotion, because that should be the one that's closest and easiest for us, I think, to actually discuss than say diet or sleep. I mean, physical activity is our wheelhouse. We're movement experts, right? So if at best 50% are doing anything ever kind of with this, what does that mean? Why is that? I can tell you why it's not first. It's not because PTs don't view themselves as movement experts, because everybody does. That's a pretty universal recommendation. In some of the surveys and interviews I've done with folks, it is very clear that that is a pretty universal thing across the profession now, that is getting out. Folks are adopting that identity, so that's great. There's a disconnect, and the disconnect is really about two things. It's about confidence and it's about environment. That's what it comes down to. In the quantitative and qualitative research I've done, the confidence piece is really explained by a couple of factors. First of all, folks are uncomfortable actually having the conversation. They don't feel like they have the skills to engage in that kind of health promoting conversation where, again, right, if we're thinking about health promotion as an empowering kind of conversation, if that's the core of it, is empowering the other person to have more control. It's not about me being the expert in that case. It's not about me providing solutions even. It's about me saying, hey, this, you're coming to me with an issue, and I think this could be one thing that helps your overall health. What do you think about that? Is that something you're interested in pursuing? So it's about giving the autonomy and giving the control to the person across from you and letting them be in the driver's seat and respecting whether they say yes or no, right? Now, there are ways to facilitate that conversation. There are ways to do that really well. So there's not to say there's not skill there, but I think the first thing is kind of a paradigm shift of when it comes to these health behaviors, we're not the experts. Our patients are, our communities are. They're the experts on their lives, not me. And so that's really, I think the first thing is how do we get comfortable with that? So I think there are courses you can take in motivational interviewing, in health coaching, in positive psychology, in self-determination. There's all kinds of different theories and strategies you can kind of get at it. There's hundreds of behavior change theories out there. So pick one that you like and then go practice. So that's one thing is you're not seeing this done because folks aren't confident. The second thing is the environment. And I think that, again, comes to this idea of logistics. So everybody believes that they have an internal, that they should do this. Even the folks who aren't doing it at some level think they should be. The problem is that they don't feel like they have the support or the environment that facilitates that, right? So again, when we talk about patients needing the support in the environment to engage in the kind of physical activity behaviors we might want to see as clinicians need the same kind of environment and supportive environment for them to actually engage in those conversations. So what does that look like? That looks like potentially incorporating this into electronic medical records as a red star kind of, you cannot sign off on this note until you've checked a box about this, or until you've said yes or no, or put in what their physical activity, self-reported physical activity is. I know that there are health systems that have done that and had success. What gets measured gets done. And so it could be something as simple as that. It could be just understanding from supervisors or from folks in management in hospital systems or clinics that this is an expectation. By and large, clinicians didn't feel this was an expectation of anybody else around them. It was just their own. And so you don't have that kind of social cohesion around a behavior if it's only internal. So providing some sort of external supports, I think, would be really helpful to really tackle those two things. So we got confidence and we got the environment as really the two reasons why outpatient PT specifically are not focused and don't engage in this.
Thank you for that. Dr. Guerrero, do you have anything else to add as well?
No, not this time. You said it great.
No, I definitely agree. So I do want to go on to the next question, a little bit more geared to you, Dr. Guerrero. So you had an experience I think would be interesting to share for the rest of the students. So could you please tell us more about your experiences as a scholar at the National Institute on Minority Health and Health Disparities?
Sure. So that came about while I worked at Mayo Clinic in Rochester, Minnesota, in pediatrics. And it was one of those situations where they say you do something and then ask for forgiveness later. So it's a program in which I believe my organization at the time highly sought out physicians for doing that and not PTs. So I have an inborn drive to advocate. And so something like that's given a name like health disparities, which is something that I live, right? I live day to day, comes very easily to me as far as interest. And so when I saw this opportunity, I applied for it, and I was soon very immersed in a program for 2 weeks that included people of all different types of professions, from social work to epidemiologists to physicians. And I'm pretty sure I was the only physical therapist, just sociologists. It really was a battery of people who have a stake and interest in the differences that exist in health that are avoidable, right? And specifically those that are related to being a minority or underrepresented group or population. What it did for me was open my eyes to 20 years plus of research, to something that I only newly had a term for, and probably at the time didn't even know how to define myself, meaning health disparities, let alone health inequities. So we learned everything you could possibly think of about race and ethnicity and differences, things that we all know now, which are again highlighted by COVID-19, that where you live matters as far as your health and well-being are concerned. If you're first born in this country, it's your health outlook and outcomes are different than if you're than your parent who was born here. So for example, if I am an African woman and you compare me and just look at the health of my giving birth and having a healthy normal weight or average weight baby, a white woman and an African woman are the same. But that generation that's born here in the United States automatically has the maternal birth outcomes of every other Black woman or African American woman in this country after living in the United States only one generation, right? So it was um, a very heavy load and piece of information that really spoke to me personally, because I am a clinician who, even in my first week of school and clinicals, because I went to Washington, St. Louis, and my very first week in clinicals, I went to class, and of course it was only observation because it was literally our first week of school, first year, first week. And we all were dressed in business casual as we were instructed, and the patient asked me to take out the garbage. And it's those type of what we now call microaggressions or micro, macro, or atomic aggressions that people who are not white in this country live under and experience, that leads to the health outcomes that we face. And so that program is a program I highly recommend. One, we at that time, what was hot was big data. So they made us do a really quick group project on big data and precision medicine. Right. So is it possible to do what we just did with COVID-19 and create vaccines that may or may not be based on a person's background, or that would work for people who don't necessarily look the same or have different heritage and lineages, right? So that was a type of program that 2 weeks was. It probably was like I said, a 20 plus year course smushed into 2 weeks, but it was phenomenal, and I highly recommend it.
Awesome. Thank you for sharing your experiences. We really appreciate it. So kind of going off of what we've been building on already throughout this event, I know you've probably both spoken to it already, but are there specific goals that we are trying to achieve when it comes to prevention, health promotion, and wellness?
Okay.
I think you can speak probably much better to this than I can, Dr. Guerrero.
I'll give it a go at it first. I would say so Dr. Rethorn said something very important, in that what gets measured gets done. And so one of the goals is in that aspiration of transforming society, so to speak, that is part of the APTA's vision, is addressing health disparities, right? There is no health and wellness and well-being if a greater percentage of the population is generally unhealthy, which is where we're at now, right? We're at a point now where our unhealthiness as a nation is a national threat, right? We don't, 70% of people who would otherwise be eligible to go to the military and protect the United States are ineligible because of health conditions, largely, which largely is a part of their weight standards, right? So they're overweight, or what we would now clinically consider obese. So it's a national threat as to where we're at, and now we need the metrics to contribute to people being well. I think that the pandemic, in a beautiful way, has highlighted how important our mental health and well-being are. And so coming up with ways that we can contribute to our partners in health, who are psychologists, counselors, social workers, contribute to the measuring by doing patient-reported outcomes, right? So the goal is one of the goals is to decrease health disparities and be an active participant in that as a physical therapist. Two, one of our goals is to have people come to physical therapists annually. There's things about movement that contribute to every single person. Like movement can help you sleep better, movement can help your heart function better, movement can help your mental well-being be better. So really driving people towards us and really getting people to document that in a way that's meaningful, that doesn't contribute to the overburden of documentation that people are already facing, and also, but really is meaningful to the person and the persons in front of you. So that is part of what I would say is part of the goal of prevention, health promotion, and wellness, and our educating the masses, that each of us become an ambassador for our communities. And your community might start with your family. It might start with your classmates. You guys could come up with ways and groups and activities that you guys can do with each other. For those of you who feel like, I don't have time for this, I don't have time to be health and wellness. But if you're unable to be your own ambassador, it's really challenging to do that in a meaningful way and succinctly for others, even though you might think you are, right? So I think once you experience something in its wholeness and fullness, you're able to create that even on a higher level for those people that we serve.
Thank you, Dr. Guerrero. That was great. And so adding on, you've definitely given us both a lot of resources and how we can get involved and how we can learn more. But is there one book that you might recommend for us students that we could go and dive a little bit deeper into prevention, health promotion, and wellness?
That's all you, Doc.
You know, that's a great question. I do not have a book that I would without reservation recommend at this point. And part of that is because, to be honest with you, most of the books that I've read have not actually helped me implement this into the way that I treat patients or into the way that I work with the community. And I think that's one of the real barriers when you think about resources is, when it comes to, let's say Patrick, right, and your practice, I'd want to know some more details to help contextualize, from my vantage point, things that I might say, hey, try thinking of something this way, or hey, it sounds like you've got these 3 things covered. What about this? And so it's really hard to make those more specific recommendations in a book format. The other thing about books is they take a long, long time to publish, and a lot of stuff has moved on. This is an area that's still evolving pretty quickly, I think, especially when it comes to sort of physical therapy and health promotion. So I would, I don't know that there's a book out there that has the most up-to-date information that I'd recommend you seek out. So I think, honestly, one of the resources I'd recommend is the Health Promotion and Wellness Council's Twitter as a great way to stay current with stuff that comes out. So I don't know how many folks are on Twitter as a professional home. That is like the one social media that I use. And I find it to be actually really useful and informative. So we as the council have a social media presence. Every Sunday, Curtis does an amazing job of curating content related to health promotion and wellness that is recent, up to date, most evidence-based. And he does a great job of not just pulling from kind of within the PT silo, but thinking big picture about community health, honing in at individual levels of how we think about interacting with patients. It's really that would be honestly probably the resource I'd recommend, especially if you're not sure where you are, you're early on and thinking about it. This is a great way to expose you to kind of the breadth of what could be out there. So that would be the one resource I'd recommend. It's not a book, Teo, but I think it's probably better. I'm gonna say better than a book.
So I guess what I would add is definitely the social media is a great place to find great resources. The council is one, whether you're on Twitter or Facebook. The APHPT, and I'll put that in the, so that's the Population Health Group there, which is originally led by Mike Eisenhart, a great person to follow if you're looking for someone that has resources and or information to put out in this area, and following people who are vested in this area, like your Dr. Zachary Rethorns, your Patrick Berners, your Eva. And then there's so many people I'm forgetting right now, and I'll write them in the chat as I recall them. But right now, I would say the reason why you don't know of a book, and I actually just helped contribute to one, and I think they want to finish it in November, that is on prevention, health promotion, and wellness, but from an interprofessional aspect. So I can definitely share that with Lisa to share with the hub when and if that becomes available. And I look at it and I think it's worth it, like Zach said, because sometimes really the goal isn't just to learn the terminology, but like, how do you implement it? Like many of you have asked today, like, what can you do? Not so. That's some of the places that I would start. But the council and the hub are a really great resource because those are people who are immersed in this area and are very responsive to people posting questions or discussions. And you have both your members, non-members, and APTA all in one space.
Thank you for the recommendations. And, like I put in the chat, Twitter is life. So for those of you who are on Twitter, definitely feel free to follow those accounts. And if you're not on Twitter, and you have any questions about how that could be beneficial to you, just whether it's for funny posts, but also as well for getting involved with the APTA, definitely reach out to any of us because it's definitely a great social media place to be. And so also we've been talking kind of about a few more resources, but Dr. Rethorn, I believe you just had, hot off the press, a new article, if you want to mention a little bit about some of the research that you recently did.
Yeah, so one of the ones I put in the chat is related to health coaching. And it was a response to basically the fact that I didn't see anything out there for how to do this in clinical practice. I am a health coach. I did a health coaching, post-grad health coaching certificate, and that's a very different model of care. I do that as a standalone service. But there's also ways to incorporate it into every conversation and every patient interaction. And so that's really what I wanted to focus on in this paper that I linked to further up in the chat. So that should get you full access for those of you here today. There's first 50 people. So at some point it's going to run out. So if folks are watching this later on and it doesn't work, just email me or get in touch with me and I'd be happy to send you a PDF copy. But this should work for all of you on today. It kind of gives some real world, how do I have a conversation with somebody about these health behaviors? Hopefully it's a resource. That's why I wrote it, is to try to help folks actually do this and kind of bridge that confidence gap that folks have identified.
Thank you for that. And another question for you both. So we've gotten a lot of tools for understanding how we can be involved as students. But what are ways that got you both interested really in getting involved at the professional level, being that at times it can be where we don't really have as much time, kind of how you were stating, Dr. Rethorn, there are those two concepts for reasons why outpatient PTs are lacking the knowledge for telling patients to really have that physical activity promotion. So what are things that you would say more geared toward clinicians now in terms of where you would go post graduation to find more resources?
Yeah, that's a great question, Teo. I think that I'm going to sound like an APTA shill here. I think the council is a great storehouse of resources in terms of connections. So depending on what your specific needs or desires would be for growing as a new clinician or even a year or 2 or 5 or 10 years out. I think that there are going to be resources on the hub page with APTA, and also if you reach out to any of the folks who are involved, if you go to a council meeting, anybody you see in that room, you could reach out to and build connections with and say, hey, I'm interested in learning more about this. And I know all of the folks that I work with regularly who are in the council are very quick to point folks to resources. So depending on what the specifics are, I would say people are your best resource here at this point. And don't discount the value of kind of collaboration and networking, even as students. I know I'm always happy to work with students and chat with students. I've worked with student groups across the country who have emailed me kind of randomly, like, hey, we're working on a project and we saw your name. Can you help us do something? So I'm always game for that. And I know everybody else on the steering committee is, at least, and I know everybody else, I'll speak for other folks in the council as well and say that, we want to see this succeed. That's why I'm here on a Sunday night, right? I choose to make the time for this because I think this is important. I think this is important to have this conversation. I think this is important to hopefully build confidence, to come at this from a positive lens, that this is not a duty, but an obligation and a responsibility that can be a joyful thing, and not a drudgerous kind of thing, which I think how some folks maybe view this. So I think people would be my answer, and go to the APTA Council, get involved, sign up for the council if you're not already, get on the hub page, follow the Twitter account, DM the Twitter account. I mean, there's like 100 different ways you could reach out and get those resources and get pointed to the right direction.
Thank you for the opportunity to contribute. I would kind of take from what Dr. Rethorn said as far as the connection in your people resources. I would encourage you, whether you're a student or a student about to graduate and soon to be a clinician, to actually look to the organizations around you and partner with them, right? We have members who have gotten forged partnerships with the local library, right? And then had sessions at the library that involve even filming and doing some education on prevention, health promotion, and wellness. And it's not everything all in one sitting, right? You might just be going that day to talk about what are things you can do if you're homebound, right? And talking about movement in certain circumstances, or what are ways that you could contribute to better and safer streets where you live and work, right? So transportation is aspect. So I'd say think bigger than what you're thinking, right? And know that all of those things that contribute to people's well-being, if you can be a part of that, you are, in fact, as a healthcare provider, contributing to the prevention end of the spectrum, as well as the health promotion and wellness of those who you're going to be caring for. So look to see who you can either partner with if you have your own practice, or if you're in a health system, and see if your leadership would be willing to, or your school would be willing to partner with the local community center, partner with a youth bike program. These are the type of partnerships that forge connectedness that was just mentioned before, that contribute to all of our well-being, and not just those who are already better off than in the wellness paradigm.
Thank you. And again, I just want to thank you both as we are coming up to 8 o'clock, for spending some time with us on Sunday to talk a little bit more about prevention, health promotion, and wellness. I know I learned a lot. If students, you have anything that you want to add in the comments in terms of things that you've learned, feel free to type that in the chat as well. I do want to just leave it open, whether there are questions, or if either of you just want to have any last remarks to give for us students.
Did you see any new questions you wanted us to respond to before we give our somewhat takeaways? I don't see, I'm looking in the chat, but didn't necessarily see any.
Yeah, not at the moment. I do see people thanking you though for a great talk, which I agree with.
So I guess one of the things I would take away, or have people take away, is to reiterate some of what I've already said. Know that everything from the way your patients, clients, and yourself sleep to your mental well-being are crucial and critical to your patient's well-being. Make sure that you know what people's individual goals are, whether you're working with an individual or a population, and not just what you think is good for them. And really try to meet people where they're at in this space of prevention, health promotion, and wellness. And stay a steadfast proponent for it. Have confidence in what you have um, been educated on, and also your experiences, right? What you've experienced day to day actually is the icing on the cake of your connection with those who are you're looking to have an impact on, or an impact with. Thank you again for this opportunity to powwow with you all.
I also
Right,
just wanted to add as well, really quickly, if you could both leave any contact information for students to connect with you after the event.
That I was going to say, the last thing I would say, if I can give a parting shot or a parting word here, is, you're not, like I said earlier, you're likely not going to see the kinds of things we've talked about tonight modeled for you in your clinical experiences. And I think that's just the reality of what the data shows us right now. That I think health promotion and wellness is potentially more aspirational for us as a profession than it is reality. Just because you don't see it doesn't mean it's not important, would be what I would say. And I believe firmly that if we do not embrace this as a profession, we are going to be consigned to the dustbin of history. That this is really vital for us to get. And it's up to us. It's up to us in this room. It's up to you all. It's up to all of us now to make these changes, to really embrace this as a core part of who we are professionally, who we are in our communities, not just in our clinics. And I think if we can embrace that, then we are going to be the kinds of change agents in our communities that I think we all want to be. We're going to be able to help bring about the kind of flourishing that Dr. Guerrero talked about, not just for folks who already have it easy to get to that point, but for everybody. And I think so. I would encourage you to not be discouraged if you don't see this, but to see that as an opportunity for growth. And as a mentor once told me, if you see something that needs to be done and it's not being done, it's likely because you're the one who's in a position or has the ability to make that happen. So if you don't see it happening, don't get discouraged, but use that as an impetus to action. Would be my kind of parting thought.
Thank you both for your both final parting shots. I think those are things that we can all agree with, especially as students and heading into the profession as clinicians. These are very important topics that we have to continue to keep in mind, especially if we want to advance the profession forward. So again, thank you both for having some time with us tonight. I hope everyone enjoyed and was able to take away a few things from this event, and we will see you next month for our next APTA Student Social. If you have any questions, they both left their info in the chat, so please feel free to answer or ask them any other questions that were not answered tonight. I hope you all have a great night.